Welcome to Chapter 7 Social Class and the Structure of Inequality with Intro to Sociology. Let's get started and go through and find out more about it. There are four basic principles of social stratification. So, social stratification ranks the hierarchy of people. It can be based on wealth, it can be income, it could be education, occupation, social status. You look at the realm and you're making decisions on where they would be placed in that hierarchy. Think of it as stairs. Because of this hierarchy, it can determine the resources. So, social classes and access to resources. There are four principles. It is a trait of society, not the individual one, carries over from generation to generation. It's universal, but can vary based on society. And it's not just about equality, it can be about values, beliefs, perceptions. So let's talk about economic inequality. Economic inequality can be involved with healthcare, your education levels, the opportunities you've had. It can be your wealth level, your jobs, where you live. So these can it can be part of all of these things to decide what is inequality in the economy. Look at the pictures below. We're going to say that there are two different families. They're on pretty extreme ends. We've got the Bridges family. The Bridges family is recently homeless. We'll say that she's had to leave a very difficult situation, and her family really needs a place to live. The son there, really, how does he get to school? How is he getting involved in things? What are they all doing for health care? How is she going to be able to work and have the kids with childcare, especially the little one? You have to think of all those costs. And if she's getting a place to rent, you need first month deposit, last month's deposit, deposits on utilities, all of those things, and they add up rather quickly when it's hard just to get the rent. In these situations, and I'll go into it a little bit more, but we've had a boom where um, shelters are having a lot of overcrowding. So they're seeing a national boom of people that are moving into motels that have been homeless during that time. They can be working poor and they're having to move in because they can't afford all of those rental fees, and also they can't get their credit score to the point where they are allowed to get rentals. So this can be a challenge. The way you're living and where you're living can be huge. The Wolf family, they look very comfortable. They're dressed comfortably. They're out on the night in the town. They probably have a nice place to stay. They don't have to worry about the elements. So they're doing pretty well off. So let's go and look at a little bit more detail. So social status can be the what people see. If I have to pick up someone from the Wolf family, and we're going to go pick up a friend from the Bridges family. When you first pull up to the Wolf family, you may be amazed. Here's a mansion, nice cars, things you may not expect to see on a regular basis. This is going to be very upper tier of our social class. Then you have the Bridges family. Now they've gotten into some housing, not in the best neighborhood, much smaller, one bedroom for everyone. So that one is a little bit more challenging. But keep in mind, they went from homeless to now where they have a place to live. Still doesn't always change a lot, but they are no longer on the streets. So you are seeing those big differences, and people notice that and put people in brackets. Food and health. So one of the things that's a big part part of inequality is food. In some areas, there are problems with having transportation. You have to take a bus system, or it has to be directly in your community, or you have to have a car. And some people do not benefit from having a car available. So if those communities do not have a grocery store right around that area, you may see what's called a food desert. In a food desert, people are having to go to things like the gas station to go grocery shopping because they can't go to the grocery store because it's so far away. They may get fast food because it's cheaper than going to a restaurant, or sometimes even cheaper than going to the gas station to eat. On the other hand, some of the people in the other side of the brackets, they have the affordability to go to grocery stores, they can go to farmers markets, they have the transportation. So those are impacted greatly with inequality and your social classes. The other thing with inequality you may see, and it's a big topic right now, is healthcare. If you don't have insurance, you typically aren't going for your annual checkup. You're not typically going if you have the sniffles to the doctor. A lot of people stop taking their medication. There's a lot of research on senior citizens that are having to decide between, am I going to pay the rent, utilities, or take my medicine? And of course, most people are going to choose the roof over their head. So in those situations, only in extreme cases, a lot of people will go to the emergency room. They have to decide on where their finances can go. On the other end, people that have full-time jobs with insurance are able to go and get medication at a much cheaper price. They are able to do annual checkups. Some have gym memberships, so that definitely shows some inequality with health. There are often perceptions on education and status. On one side, you see the surgeon. A doctor, what do most people say when they're younger? I want to grow up to be a doctor. It's a prestigious, we put it at a higher level in the United States in ranking. We consider it a higher social class. They've had the education. There's a lot of respect for that position. And, even if they were doing it at a local clinic, there's still that level of what's considered prestige. On the other hand, we have the picture of the man that's doing the trash pickup. Very admirable position. We all need him to do this, and we would all be in a bind, but he's not considered at a high social rank. In fact, usually the manual labor is considered a lower social rank. So even if for example, if a person had a construction versus the doctor, and they made the same amount, their status could be very different, meaning the doctor would be considered higher. It's not always just about the economic piece. Education, you all are in college now, so whenever you tell people that you're going to college, they definitely look at you at a different light. It's very positive. You again have went up in the ranks. People look at you differently. They want to find out what your plans are in the future. But if you were saying, on the other hand, I'm not going to college. Have a high school degree or GED. There's different perceptions from that to a master's. So education plays a big role in it. Even when we have children that are younger, we always want to make sure that what are they doing in school? How are they getting involved? We're seeing an increase in getting students involved early, looking at test scores, looking at grades, looking at community activities. So education has started playing a huge role in our social class. So there are three major systems of stratification. First one that we're going to talk about is the caste system. The caste system, usually you'll hear about that in India. It is where you are born with your job, your marriage, all of that, you're going to stay in a certain realm. If you're born in the lower level with, let's say, my grandfather worked at a mill and in the mill community, that means my mother would work at the mill and marry in that mill community, and I would be born there and work there. So there's no opportunities to go up or down in that belief. You are where you were born and you stay there. It's inherited. So that is a closed situation. In slavery, the person is owned. They're denied rights. They have no opportunities to make decisions go up and down that because someone else is making those decisions. So that again is closed. No opportunities for up or down. The last one that we have a lot in, specifically looking at the US, we're going to talk about. This is part of the class system. So in the class system, you can move up or things can happen and you might go down. You might be born into a certain class, but you can move up and down. Intersectionality is a concept that identifies how different categories of inequality with race, class, gender, age, they intersect to shape the lives of individuals and groups. So when you're doing your research, it's very important to look at that detail as well to see if you see social classes, um, any inequality as well that can affect that. So social mobility and social class is, let's go through and use examples. You were born into a family. They were very excited for you to go to school, so you went on to college and you graduated. From college, you got married to someone that was in a class above yours. Her family was more wealthy and well known in the area, so again, you climbed this ladder. Think of it as there's ladders or steps. Then you had this wonderful job and they came to you and offered you a promotion. Okay, so now you're at a very high peak in the ladder of the social class. But maybe there are two different things that could have happened all of a sudden. Maybe your child got very sick and they had to go to the hospital. And that meant that you had to stay out of work and be there beside them. That meant when you're not working, how are you paying the bills? And how are you going to cover the things with the hospital as well? You change your level by doing that. Or let's say your work that you just got the amazing promotion from, say 2 years from then, suddenly they're making cuts for their budget and they come to you and say, you have 2 weeks notice, we're going to have to let you go. Now suddenly you're out of a job. And jobs are not easy to get with all of a sudden. So that's going to change the dynamics, not only with your income, but think of it this way. When someone, one of the first things when you're meeting people and they're trying to get to know you, what's the first question that they ask you? So what do you do for a living? And then the next one, you can either say, I'm working at this place, or I'm going to college right now. Even you might could say I'm a stay-at-home mom, or I volunteer, but not many people want to say, I just lost my job. So again, those rankings there can be based on jobs or the influence that's put there. So being unemployed says something about the person that's beyond just, in our perceptions, beyond just wealth. There are different classes. So think of it again as the steps that go up. The top of the stairs, there's the upper class. This is the elite. They're the largely self-sustaining group. They can live with their stocks, their businesses they own, and they have the most of the country's wealth. They're a small percentage of people. Upper middle class is a social class consisting mostly of educated professionals and managers who have considerable either financial stability. These could be lawyers, engineers, business owners, managers. So you're going to see this as the upper middle class. Middle class is composed primarily of white collar workers with a broad range of education and incomes. They're not typically manual labor or physical labor individuals. They are doing more of um, using salary versus hourly income. They usually have insurance with their work. They typically, some examples could be an accountant, someone in banking, someone in nursing, human resources. Those are just a few of them, even the analyst or researcher. So this could be in the middle class. Working class, that's the social class consisting mostly of blue collar workers. They are either in the service industry or doing manual labor. They typically do not have a college degree. They're doing hourly work, maybe retail, waiter, construction, manual labor out there as well. So those would say, what is a blue collar worker? A description from the book is they're characterizing skilled and semi-skilled workers who perform manual labor or work in the service or clerical jobs. Now we come to the working poor. These people are maybe poorly educated. They're doing manual and service workers who may work full-time but remain near or below the poverty line. And then there's also the underclass. Those are the poorest group. These are sometimes the people that are experiencing homelessness or are chronically unemployed. You're going to see in the chart below, and you'll notice this is the federal poverty guidelines for 2025. So if you have a household, let's say you and one child, to be at the 100% poverty level, your annual pay is going to have to be $21,150 to be considered the 100% poverty level. To be at the 150%, you're going to go up to 31, and of course 200%, you're going to be at 42,500. Some may say, wow, I'm making less than that, or some are going to think that's a very low number. These are very key, especially when someone's seeking assistance. Also, these are key whenever you're going to look at populations. You could look at an area, how many people are at the federal poverty level, how does that influence some of the it could be one of your variables that you're using that you're going to look at this material to help make decisions on your theory. So definitely keep this in mind. You can always look this up. It changes from year to year, but not drastically. So I thought I'd give you just a few facts and let you look at how people are surviving with their income. So in North Carolina, the minimum wage is $7.25. If you look at Charlotte, a typical two-bedroom apartment costs $1,700. Now I've included a chart that's from NorthCarolinaBudget.org, and this breaks it down on how much someone would need to survive, and this is with one adult and one child, or two people in the household. So it breaks down what the person would typically need to survive, and it shows you and I'd like you to look at it a little closer if you can. Shows you cost of housing, childcare, healthcare, some miscellaneous, some transportation. So it breaks that down, and it breaks down in categories. It also shows you, in order to achieve that, what amount per hour you would need to make um, to survive at that level, and how many hours you would have to work to be at that level. So a lot of us are going to be surprised by that amount. A couple of other quick notes that I found. So in North Carolina, if you break it apart just by income, so we have 17% of the people are making 150,000 or more. 16.5 or 100,000 to 149,000. 13% are 75,000 to 99,000. 17% are 50 to 74,000. And then just to give you a note, 1 in 4 people earn less than 35,000. So you're going to see there's a big difference and range there. But again, a great option is for you to go look at some of these websites. Try to go to some that are government related or some nonprofits, and you can get some great facts on there. And these are used, the federal guidelines, the North Carolina guidelines are used to make some decisions out there when it comes to funding opportunities and looking at communities themselves. So there are some poverty concerns. Look at your own community. Some are education. Can people get enough education? Are our kids that are in Title I schools getting the same opportunities as those that may be getting private school educations or go to a more predominant public school in the area? There is childcare issues. If someone is making minimum wage, but childcare costs more than minimum wage per hour, how are they going to crawl out of poverty because the job requires the children to be in either a childcare facility or for one of those service programs to jump in and offer support. Healthcare I touched on with poverty concerns. A lot of them do not have insurance. If they do, it's very limited. So the concern is, do you get regular checkups with uh, general health, with dental, with vision? Think of it this way: if you have to go to work and you haven't had a vision exam in years and your vision is off, but you don't have the healthcare insurance to go get your eyes checked, that could impact your job. A lot of the people that are having poverty and have healthcare issues, they don't go get those regular checkups. They don't go whenever they're not well. And as I mentioned, sometimes they're having to not take medications because you have to decide, am I keeping the lights on this month or am I taking this medication? And so that's become a big issue that's out there. Um, some people wonder, can we still or should we still provide services? The services could be anything from food assistance. If you don't know about the program, this is the backpack program. That's where kids can get food. Usually it's on Fridays, and backpacks are filled up so that when the child leaves, the students don't know. They just think the kid brought an extra backpack to school, and that backpack is filled with food for the child to take home to their family. Uh, so that's one. We've got food banks. We have soup kitchens. We have where people have to go get emergency assistance with their electric bills or the shelters. Our shelters are filling up like enormously. Our poverty level has increased dramatically. And if you look at the COVID statistics, it keeps growing. Again, that point in time, where they're going out and surveying people and getting a collection of how many people are experiencing homelessness, either on the street or in in shelters. That's coming up. So there's so many different services out there, maybe even a boys and girls club, so that the parent has to work, the child gets out of school, what are they going to do? And they can't afford it, they'll go to something like a boys and girls club or YMCA. There are people that say there's lack of funds. We don't have enough money to keep taking care of everyone. That's something that you will hear often. And that's, again, we hear that out there. There also have been problems with that. You look back during COVID, there were a lot of people in need, but all of the money that was normally being fundraised and coming into those services or government programs, those did not have money coming in because a lot of those jobs had slowed down. So people weren't able to give back. And the lack of funds was not there. So we're going to possibly see that lower. The homeless and housing, I mentioned that briefly about our homeless shelters are growing, our housing. One of the things they're looking at is, again, people having to move into motels because the shelters are too full. And how much is that? A motel costs more than renting, but they don't have the credit score to get into a rental apartment or a rental house. Uh, they may not have all those additional funds up front to take care of things. And if you miss your rent, you're out. So that's become a big item. Is there affordable housing out there? There are some communities where they're requiring new builders to put in affordable housing options. That's going on in Chapel Hill, a little bit in Davidson as well. So that's something to look at. We do have a big boom in housing going on right now. And one thing you might want to look into is gentrification. Gentrification, that could be where there is a community that's been there forever. Maybe it's in poverty, just maybe it's an older community that's not well off. And these builders come in and want to bring in the brand new buildings or the bigger houses, and that they pay these people a small amount, and those people, or the landlords, get paid, and everybody that was living there at a lower amount, they're kicked out. And that becomes, the brand new great community where all the very high end things are. So we're seeing a lot of gentrification going on. Population growth. Charlotte is in the top 10 fastest growing cities in the United States. So, and not everyone that's moving to Charlotte has a high income. Not everyone's middle class. So we're seeing a growth, but we still have the same number of services. And how do we match those services with the population growth? Jobs. We are having, again, that population growth, but we may not be able to sustain the number of jobs, or do the jobs meet what people need? If the mom can only work during the daytime hours, then, and when her child's in school from 7 to 3, but all the work out there is maybe 8 to 5, that becomes a problem. Are there enough job opportunities for people at all different levels, but people at poverty? Are they going to be required to get educational opportunities to go up in their out of the poverty level? And can you climb out of the poverty level is often the question. Are people stuck there? Lastly, is community. Is the community welcoming to those that are in poverty? Is there a support system? I did see a lot of that during the SNAP, when SNAP was stopped. You suddenly, with Ada Jenkins, they're up in the northern part of the county, and they provide services. So they put out a message, we need things for our emergency assistance food bank area. and people suddenly started collecting things. All of a sudden, neighborhoods. So we saw diaper collections, women's hygiene collections, food. All of this came in, and I know we delivered some, and they had people dropping off continuously. So the nice thing you're able to see there is there became an awareness, and in that community, they came together. You could hear that with other places with Christmas time. People jump in and want to give. But there are going to be some people that say, this is my community. I don't want them around here. Or they're taking up this, or they're bringing down the community. They're taking too many resources. So, of course, that can come up with some poverty concerns. So that's the conclusion of chapter 7. This one, of course, with that nonprofit background I have, definitely is close to my heart, and I get very excited about sharing this information. If you are struggling with inequality, needing resources, great start, because there are lots of resources in this county, is contact the call center with 211. 211 will direct you to what services you may need. Maybe you need the domestic violence program. They can direct you to their phone center. Maybe you're needing food bank, or you're wanting to arrange for your child to get the backpack program. They can direct you to that. Um, there are opportunities. Maybe you need housing, or maybe you need rent assistance, or maybe you need counseling or legal assistance. They're going to be able to direct you to those programs. And once you get there, of course, people are willing to help you. It is sometimes frustrating or very nerve-wracking to ask for that help. And again, because we are put in social class levels in the United States, sometimes that can be a little hard to feel comfortable talking to someone about it. But again, feel free to do that. And of course, if you ever need to know about some resources, I'm always willing to share. You can email me either about needing some resources out there in the county, because I'm very familiar with them, or if you need help with your paper that's going to be with this chapter, or if you need some information about the chapter itself or any of the materials, or just if you have a random question. I will reply within 48 hours. I've been much quicker than that. Usually it's within a few hours. If you talk to the people that have emailed me, we can set up a virtual meeting, or we can email back and forth. So I'm happy to do either one of those. You also have your Chapter 7 quiz with this. You're going to have more quizzes coming up, so keep that in mind. All assignments are due by 11:59 p.m. Remember, give me up to a week to grade the assignments. And lastly, of course, there is read the attached article that's with this chapter. This is very, very important that you do this paper. So you need to read the attached article and write a paper. Make sure you follow the instructions with it. You're going to definitely want to show your different elements of it, and just dig into it and find out. When it says opinion, I think that's confused some people when you read some of the articles and it says give your opinion, give your insight by using what you've learned with statistics or with proof. So give some proof of why you think that direction would it go. So not your, I like this. It should always be, this is why. So anyway, I appreciate you listening, and I'll see you at the next chapter.